Thank you for joining us for this segment of the Mental Health Series presented by Intellios, which includes the American Registry for Diagnostic Medical Sonography, ARDMS, the Alliance for Physician Certification and Advancement, APCA, and the Point of Care Ultrasound Certification Academy, in partnership with the American Psychological Association. Your mental health is just as important as your physical health, and even more so when you are in the middle of a crisis, dealing with new challenges and uncertainty. The well-being of our healthcare professionals is critically important to us, which is why we created this mental health series. We want to help take care of you so that you can take care of your patients, your friends, and loved ones.
Hello, and welcome to today's webinar. I'm your host and moderator, Heather Rochot, Chair of the Intellios Board of Directors and a registered sonographer at the British Columbia Women's Hospital in Vancouver, Canada. Intellios is proud to partner with the American Psychological Association to bring you a three-part webinar series focused on important and timely mental health topics. Today's webinar is the second of the series, and we will cover the topics of stress and burnout. The next webinar in December will focus on resilience. For additional information about these webinars, please visit our websites. Now, before we get to today's presentation, there are a few things we need to cover first, some housekeeping announcements. Today's webinar is scheduled to last 1 hour, including some time for live question and answer at the end. Viewers, you can submit your questions for the speaker through the chat box on YouTube. Staff members are monitoring the chat. The webinar is being recorded and will be posted on the ARDMS, APCA, and POCUS websites for on-demand viewing afterwards. Plus, we have additional mental health resources available on our websites. Finally, this webinar is approved for one free AMA PRA Category 1 CME credit, and to claim your credit, we will provide a web link at the end of the webinar. So you must complete the CME assessment survey to claim the credit. So today's learning objectives are going to be briefly shown on the screen. These apply to the CME credit that is available for the webinar. And next, we have our disclaimer. Please note that this webinar is for informational purposes only and is not intended to provide medical advice or to be a substitute for professional medical advice, diagnosis, or treatment. And now, I'm very pleased to introduce today's speaker, Dr. Mana Ali. Dr. Ali is a member of the American Psychological Association Division 22, Rehabilitation Psychology, and the attending psychologist on the Spinal Cord Injury Disease Unit at MedStar National Rehabilitation Hospital. Rehabilitation psychologists often work within teams to assess and treat cognitive, emotional, and functional difficulties of individuals with disabilities and chronic health conditions. Dr. Ali also serves as the Director of Training for the Rehabilitation and Pain Psychology Postdoctoral Fellowship, as well as co-chair of the Diversity Inclusion Committee for Equity at MedStar National Rehabilitation Hospital. The competing global crises, including the enduring COVID-19 pandemic, have understandably been overwhelming. Every aspect of our lives has been affected, from health and work to education and relationships. While it can feel counterintuitive in such an uncertain and demanding time, we need to make time for our own coping and self-care. Psychological research has consistently shown that self-care not only benefits people's physical and mental health, but enables them to carry out their jobs more effectively. Dr. Ali's presentation today will highlight the symptoms of burnout, elicit resilience, and provide strategies for self-care. Mana, thank you so much for joining us today. We're really excited to have you.
Thank you. Thank you for that introduction. I'm grateful to be a part of APA and this collaboration. That's exactly what we need during this difficult time, partnerships. So as she mentioned in that lovely introduction, my name is Dr. Ali. I'm a psychologist at National Rehabilitation Hospital, serving primarily on the spinal cord injury unit. Today in this webinar, I hope to talk with you about battling burnout, particularly during this stressful time, the COVID-19 era. Next slide, please. So these are the objectives for today's webinar. I won't go over them. They were in the previous slides, but they're here for you to reference. Next slide, please. I have no disclosures or conflicts to mention. Next slide, please. So I put this big red square here. This YouTube format doesn't allow for much interaction, but I really wanted this to be an opportunity for the folks who are tuned in to self-reflect, to develop a resilience plan, to begin to build insight into what their burnout and stress looks like. So anytime that I pose a question in red, it's not necessarily a rhetorical question, but I want that to be an opportunity for you to reflect on the content that we're talking about in that slide. So if it's helpful, grab a pen and pad, a journal, use your phone, but I do want you to be able to take notes and sort of engage in reflection and insight building. Next slide, please. Thank you. So I wanted to start off by first describing a little bit about our subfield, rehabilitation psychology. Most folks aren't familiar with this subfield. It's a specialty area that really began crystallization after World War II. So in 1940s and 1950s, there were many soldiers returning from war who had just sustained a number of physical injuries. And of course, this has had a huge mental health impact. Initially, psychologists and specialists who were helping veterans were focused on reintegrating them into employment or vocational rehab, but that quickly changed as it became more glaring that people who were coming back from war needed support holistically, their emotional and mental health. And so rehab psychology really formed because we wanted to assist individuals. So it's brought in, obviously, not to include just veterans, but we want to assist individuals who've had injury, illness, as well as their family achieve optimal physical, psychological, and interpersonal functioning. So we work primarily with the medical population and people who have disabilities. We work across rehabilitation settings. So we are and have been frontline workers during this pandemic. They're rehabilitation psychologists in the intensive care units, and we're there during COVID surges. I work in an acute inpatient rehabilitation hospital. So we also have a unit designated for persons who have tested positive for COVID. Subacute rehab facilities or nursing homes, as well as outpatients. So we have been frontline workers. And if you want to learn more about the subfield rehabilitation psychology, I'll direct you to our division's website. We're represented by Division 22 within APA, which formed officially in 1958. Next slide, please. Thank you. So what do rehabilitation psychologists do? What does it look like just generally and during this time? Well, we assess for cognitive functioning. So people who have had injuries or a disease process that affect the brain. And that's also been true for people who have had complicated COVID courses, hospital courses, or residual effects from the condition or complications from the condition. Capacity evaluation, so whether people have the ability to make medical decisions, financial decisions, and other important decisions in their life. Emotional and psychological functioning, I think psychologists are most known for that. But we also do evaluations to establish candidacy for any medical intervention. So spinal cord stimulator evaluations, transplant evaluations, things of that nature. Next slide, please. Common areas for intervention. Some of these may be familiar to you where psychologists intervene. And for sure, all of these have been very, very important in areas for intervention during the pandemic. And a lot of these areas have been exploited by the pandemic, but these, I won't walk you through every bullet point here, but we definitely intervene in all areas that might impact quality of life, from emotional functioning to sleep and pain. Next slide, please. Thank you. Because we work with healthcare providers, we work within a team. I work in a hospital. This is a picture of my team on the spinal cord injury unit. It's a pretty comprehensive team, again, because people are multifaceted, and recovering from a disaster or trauma or physical condition requires attention to the whole person, their diet, their mobility, their psychology. So we have an interdisciplinary team. So I know firsthand that during the pandemic, things have felt very disrupted at work. As you can see in this picture, we're laughing, we're smiling, there's a potluck. I mean, this was pretty much business as usual. And so taking this away from an environment where we're used to being a part of a team, where we're used to having a village at work, has definitely been a loss during the pandemic. And so many of you may find yourselves feeling the same way, that you don't have the connectedness or the time with your coworkers that was so valuable to you pre-pandemic. Next slide, please. So who else do we help? So in addition to helping patients recover from some traumatic or chronic medical condition, whether it's acquired or a complication from a pre-existing, maybe congenital condition, we also help their family, their caregivers, and their support system. And this has also been especially true during the pandemic, and especially stressful because, as you know, being in a healthcare setting, there's been tons of restrictions on visitation policies. And so we've done a lot of work with caregivers and support systems to help them feel included, help them feel connected, help them feel a part of their loved one's care while they're in the hospital. So caregiver work is definitely something that we've always done, but again, it's sort of ramped up because of the pandemic. We also help our team members. As you saw in the previous slide, I work with a huge team. And not only do at times they require consultation regarding patients, right? The things that the patients are going through or how to best treat their patients, but also with their own reaction. And again, this is especially relevant during COVID because not only is work a stressful place, a healthcare environment a stressful place, but the world, there's so many competing national and local crises that people are really having a hard time managing. And so psychologists have been, I'm obviously biased, but been valuable members on the team, especially during this time. Next slide, please. So again, everything that I named was business as usual prior to the pandemic. And once the pandemic occurred several months ago, we've done business as usual, except we've had to adapt to the current circumstances. So we've adapted the way that we practice, so much more telehealth. We still do in-person visits with patients who are positive for COVID, inpatient visits for folks who are in the hospital recovering, but we've had to adapt like most of you have. We've adapted research protocols. There's been much more of a focus on assisting with connectedness during this time. So because patients are in hospitals, isolated, staff feels more isolated, we've had to become really creative about how to help with connectedness. And we'll talk about some of those strategies as we go through the webinar. We've had to help patients and ourselves promote self-care, and our staff promote self-care and elicit resilience, because this is a difficult time. It's easy to feel like you're drowning. And so we've had to pay special attention to helping people understand and pay attention to their fortitude. And then, right, helping staff recognize burnout. So what exactly is burnout? That's what we're here to talk about today. Next slide, please. So burnout is actually recognized by the World Health Organization, and it was mentioned in the ICD-10, but has been given more detail in the ICD-11. It is an occupational phenomena, so relevant to the workplace. It is not a medical condition. It's not a clinical disorder. So below in quotes here, you'll see some of the detail that was added to this phenomenon. So it's a syndrome conceptualized as resulting from chronic workplace stress that has not been successfully managed for a variety of reasons, I will add. I will talk about some of that throughout the webinar today. And it's characterized by 3 dimensions: Feelings like you're exhausted, like your energy is completely depleted, you're running on fumes, or you're empty. Increased mental distance from one's jobs, feeling more cynical or negatively towards your job, and just a reduced sense of professional efficacy. Like you don't belong in that position, it's not meaningful to you, you aren't capable at being successful in that role. So these are common dimensions that are tenets of burnout. Next slide, please. I like to call these burnout amplifiers, but I think bias in the word amplifier is that these concepts listed here make burnout worse. And I would say that it's really a reciprocal relationship, that when you are burnt out, it's likely to amplify some of the things here. And for sure, some of the things here are going to exacerbate or make probability of burnout maybe a little more increased. This is not a comprehensive list by any means, but some of the factors here may again contribute to an accelerated burnout rate. So low job satisfaction, not feeling like you are getting rewards from your job, whether that's at baseline and then exacerbated by the pandemic, not feeling like you have a say in your workload or work responsibilities, so decreased autonomy, maybe job demands are too high, your expectations are too high or too low for your position. And as you see, as we get into the list, some of these things aren't directly related to your work, right? They might be indirectly related. So if you're having relationship discord or problems within your marriage, that can exacerbate difficulty at work, right? It's hard to really set boundaries, especially now when most of your work life is at home. A lot of people are working from home now. Those boundaries have for sure been blurred. Lower activity in outside leisure pursuits. So, I mean, the pandemic has definitely taken away a lot of our ability to engage in hobbies, engage in activities that make us feel meaningful. And external locus of control also amplifies burnout. So some of you may not be familiar with that term. So external locus of control just suggests that external factors really help you, you really rely on them to dictate the outcome. So I guess one silly example is, let's say I'm in a financial bind and I say, well, I'm going to be okay once I hit the lottery. Well, that's great, but I can't control when I hit the lottery. I have no control over that. And so therefore, in my financial position, I may feel helpless or powerless or impatient. If I had a strong internal locus of control, I would focus on abilities that are reachable, that I can do, what's in my control. So instead of saying, I'm going to wait till the lottery to relieve some of this financial stress, I might say, well, what can I do now? If I had a strong internal locus of control, I might focus on applying to jobs, fixing my resume. These are things that I have control over that help me feel less powerless in my current circumstance. Passive coping, so not initiating activity that might help you feel more in control or alleviate the problem that you're in. Lower self-esteem, decreased ability to take a vacation. We all know that's been the case with travel restrictions, local, national, work travel restrictions. Poor health behavior. So health behaviors is the umbrella for substance use, exercise, sleep. If these are things that I practice in a maladaptive way, again, it may make that the trajectory toward burnout just a little more steep. Lack of social support. Social support is widely known as a protective factor and supports resilience. So that could be social support within your household or your friends or even within your work community. And of course, you know, as healthcare providers, we work with patients who are vulnerable, patients who are at, for some, the worst parts of their lives. And so we may have come into contact with patients that eventually don't have great outcomes. this takes a toll on providers. This could take a toll on anyone. And so that can also amplify burnout. And again, role conflict, which has definitely been a big one for most people. With kids at home and work changing, it's just you're pulled in 10 different directions. And so again, all of these things amplify burnout. Next slide, please. Thank you. So here's one of those red questions that I want you to just take your own pulse on where you fall. So burnout looks different for different people. Yes, the ICD gave us, nice details, but people, we aren't by the book. We're all different. We all have various things that influence how we manifest stress, whether it's cultural or just learned experiences, conditioning processes. So what are your burnout signs? How do you know when you're burnt out? Now, I have these laid out in different categories, but again, you can experience multiple of these factors within sort of a category, between categories, more than one, across one. Everyone's profile will look different. So burnout can manifest through your emotions. You might notice that you feel extremely and chronically worried, that you have prolonged sadness or guilt. You feel hopeless, helpless, more cynical, pessimistic, things that you typically find meaningful and pleasurable, you're just not interested in anymore. You might notice that burnout manifests cognitively. So you just feel like you're in a fog. You have trouble concentrating. You have difficulty remembering things. You feel stuck. It could manifest in your body, right? So if you're having chronic stress or burnout, you might notice more aches and pains, more constipation, changes in appetite, undereating, overeating, undersleeping, oversleeping, difficulty falling asleep, difficulty staying asleep, or it can manifest in your behavior. So you might notice that you're smoking more cigarettes or drinking more alcohol. You're moving too fast or moving really, really slow compared to your typical pace. You're overworking, withdrawing. You're not engaging in self-care. If you're someone who loves to put on makeup and you're noticing that you just haven't done that, or you just aren't showering or brushing your teeth daily because you feel different, that might be a sign. If you are chronically absent from work, that also might be a sign that you're burnt out. Again, these are just examples. This is not an exhaustive list, but I do want you to take note, because if you understand your signs, that definitely gives you an opportunity to say, something's going on, I'm off, let me do something about it. So take note of your burnout signs. Next, please. What are the effects of burnout? So for work specifically, you might notice that you're making more mistakes. And mistakes everyone makes mistakes. No one's supposed to be perfect under any circumstances. But when you're feeling burnt out, or when you're headed toward being habitually burnt out, the mistakes are more frequent and they're more egregious. So just be on the lookout for that. When you are in a crisis, those skills are usually preserved. So if you're someone who's in your office and you've learned a fire drill and there's a fire in your office, you're likely going to remember what to do, because by design, we're created to survive. We have that fight or flight system. So skills in crisis are generally preserved, but you're making more mistakes in routine tasks. You probably noticed that you just don't have the patience or patient-centered communications that you might typically have. You might notice compassion fatigue, where you were someone with just empathy for all of your patients and time and great listening skills. That might be blunted with burnout. You might notice increased interpersonal conflict at work and outside of work, more chronically absent. Your productivity has changed significantly. But I want to be clear, because taking time off is very different from being chronically absent. In fact, you should take time off. That's a part of self-care. That's a part of rejuvenating. That's a part of relaxation. That's very different from being chronically absent. So I just want to make a distinction there, because I think it's important that people do take time off, particularly during this stressful time. And burnout contagion. This is a phenomena that if one employee in a working environment starts to feel cynical and more negative, that can actually spread to other workers in that same environment. So this is one of the effects of burnout. Next slide, please. There are some stages of burnout that have been identified here. So the first stage, and again, most of the time people say stages, they think sort of these cookie cutter time frames that you start one stage, you end it, and then you go into another. So that's how it's listed here. But in a second, we'll really talk about how burnout might manifest. So typically the pattern that you might see is you just start a job or a new project and you're overworking, you're enthusiastic, you're committed, and then over time you just kind of feel stuck. You feel like you're not making any progress, you're more frustrated, you're more anxious, you're more irritable, and to the point where you just resign, that there's just more problems that aren't being addressed. You just don't care as much, to be frank. Next slide, please. And again, as we talked about earlier, burnout are not specific to those emotions. So this is a visual of what I mean. When I say stages, most people, mine will go here, that you're enthusiastic and then you start to stagnate and then so forth and so on. Advance, please. Or some people may think of burnout like this, that over time, you just are on that downward spiral. You know, you're enthusiastic, then you're stagnating, then you're frustrated. But actually, it looks more like this last slide. Next, please. So yes, chronic burnout, you're trending downward, but you have ups and downs. The days look different. The emotions look different. That can vary within a day. That can vary between days, within a week, but the trend is still downward. And I say that because, again, there's no like right way to know if you are burnt out. There's not a calculation that I can give one person that fits everyone. So it's just really important to start to understand your patterns and how it might be manifesting for you. Next slide, please. Thank you. So why do we need to battle burnout? Why is it important? Well, as providers in the healthcare field, we have an ethical obligation. In fact, one of our standards in psychology, as psychologists, standard 2, we have to recognize, one, when we're having significant distress in our personal lives or with self-care, and it's our obligation to recognize the impact on self-care, patient care, stop patient care, and then seek help. We make an oath to that that ethical obligation. So we have an ethical duty to be our best selves for the people that we serve. Increase career satisfaction. When you're your best self, you are likely to see the greats in your job. You're likely to feel a greater sense of reward. You're likely to show up as your best self and get to experience some confidence day to day because you're doing good work. I like to say all the hurts hurt together. So when we talked about the amplifiers and how all these things are related, if we can manage burnout at work, if we can navigate that process, it likely will have a positive impact on other areas of our lives. There's a lot of spillover. You can't pour from an empty cup, right? And this goes to the infamous airplane example. When they say, oh, if oxygen levels drop, put on your mask before you help anyone beside you, even if it's a child or vulnerable person that's beside you. Well, the same goes here. If you aren't your best self, you can't be of service to the people that you love. And so a lot of battling burnout is really understanding that taking care of yourself and battling burnout is a very selfless act. It's not selfish. You're putting yourself first, but that is so you can be the best person that you can be for the people and the things that are meaningful to you and that give you purpose. And it just feels better. I believe that people don't wake up and say, hey, sign me up to feel crappy today. Sign me up to have low job satisfaction. That's not how it works. People want to feel good because feeling good feels good. So that's, if anything, that's a good reason to want to battle burnout. Next slide, please. So here's one of those red questions again. I want you to think about what aspects of the pandemic have been most stressful for you. It's different for different people. And you may, as you reflect, you may think, well, none of these is something else. So again, not a comprehensive or exhaustive list, but take a look at this list and ask yourself, what is the most stressful part to me? Again, it can be multiple things from this list. The reason that's important, if you know what's stressful for you, you can develop a plan. Everything is clear. Anxiety feels better when there's a plan. Your sense of control and power feels better when there's a plan. If you just have a blanket statement that I know I don't feel good, I'm burnt out, but really can't identify why or aren't working toward clarity about what aspects of the current environment makes you feel burnt out, it's impossible to develop a measurable, achievable, relevant, timely plan. So, for example, if physical isolation is the part that feels most stressful for you, that's sending you on a burnout spiral, then you should target that. So I can give you an example because, as you've seen from the picture earlier, we work as a team. I see my team every single day prior to burnout. We meet, we laugh, we joke. That hasn't been the case because of the pandemic. So every Monday we meet for lunch virtually. So I'm targeting the value. I'm targeting the fact that I like being with my team. That helps me direct the plan better. Or maybe what's most stressful for you during the pandemic is the competing needs that you're working, you have children doing virtual learning. I mean, you're pulled in 5 different directions. If you know that's the most stressful part, you can say, all right, this is what's stressful for me. Let me go to my household. Let me go to my job and delegate responsibilities or reshape what my day-to-day role is in a way that provides me some relief. So really understanding what's stressful for you is important to develop a plan. Next slide, please. So it's not much research on COVID because it's new. There's not a lot of long-term research. It's changing every day. My boss jokes and says the COVID research is like a grocery label and it has an expiration date because as soon as one study comes out, another one comes out because, the business is booming for this type of literature. But this one study wanted to understand the impact of the pandemic on mental health professionals. And so it was a systematic review. You can advance to the next slide, please. And so this is a table pulled from the study. Sorry, the text is so small here, but it found that generally these are things that were stressful, that anxiety, out of all of the mental health conditions, right? We know from other readings and literature that anxiety is the one that shot up the most, right? Depression too, but anxiety because the pandemic has brought on a state of uncertainty. When is it going to be over? How am I going to get through this, right? And anxiety likes to live in places where it's unfamiliar and uncertain. But these are some of the themes that came up across providers about what was most stressful for them or what maybe exacerbated mental health, negative mental health symptoms. And so as you see COVID exposure, am I at risk? Am I putting my family at risk? Is this trade-off, is this sacrifice worth it? Going to work every day? Those type of questions, making decisions about loved ones. Should I send my kids to school? Should I not? Should I go to work? Should I not? Epidemiology, depending on where you are and local guidelines and conflict around that, conflict around policies, access to PPE, human resources. What does it mean to, within your own organization, do you feel supported? What's your leave policy like? And then other personal factors. So women were more likely to report anxiety and depression. Younger folks were more likely to report fear of contracting the virus, but older folks were more likely to report a fear of death from the virus, right? And of course, having a pre-morbid mental health condition makes you more vulnerable to difficulty coping during something like all of the trauma that we've seen with COVID and other competing social injustice qualities, fires. I mean, this has been quite the year. I think we would all agree. You can advance to the next slide, please. So before we jump into more burnout, I want to make a differential here. So moral injury is a little bit different from burnout. So moral injury is a phenomenon when providers, healthcare staff, we choose to do what we do because we want to help people. And we've made a lot of sacrifices to be in our positions: financial, student loans, moving maybe from state to state, time spent in school. And we do that, and we do that because we want to help people. We have a moral compass that's pointed in a direction of helping people. And then we come to work, and then we're in the healthcare system, and then we start to be exposed to brokenness, systemic barriers, lack of resources, and we start to be conditioned to looking at insurance versus looking the vulnerable person in front of us in their eyes, knowing that we can't provide them resources, we can't provide them services because of all of these other barriers, productivity, insurance. And so what that does is it really chips away at someone's moral self. And so the idea of moral injury isn't that I'm a broken person, that I am burnt out. It's that I've had to adapt so much to a system that's broken and it's taken a toll on me. That's not what I signed up for. And so this is something that we see in providers, which is different from burnout. Next slide, please. Vicarious trauma is something that has predated COVID and the COVID surge, but for sure has been exploited by the pandemic. So vicarious trauma is a state of tension or preoccupation with the stories and traumatic experience that are described by your patients. So you don't necessarily have to witness, someone in a very intensive care unit who's battling COVID, but just hearing the stories of social injustice, hearing the stories of wildfires, becoming intimately tied to those mentally can create vicarious trauma, which is recognized within the book that we use to diagnose folks, which is DSM-5. Can you go to the next slide, please? So here's a list of some of the symptoms. It's important to know because, frontline workers are at risk for this. So it's important to know if you're experiencing these, you absolutely should mention it to a health professional because the interventions are different, right? This is different from burnout. So the interventions and the targets are going to be different. Can you go to the next slide, please? So how do we start to battle burnout? Well, one option is self-care, which most folks have heard a lot about up until this point. So I'll try not to sort of be redundant to some of the previous webinars that you've had, but I just want to make a few points about self-care. Next slide, please. What is self-care exactly? We hear, take care of yourself, take care, self-care, but what does that even mean? And it's so vague and it's so broad, but I want to highlight two very important pieces of self-care. It's intentional and deliberate, okay? It's being intentional and deliberate about performing an activity to take care of your physical, cognitive, and or psychological health. The reason I highlight intentional and deliberate is because it's never going to feel convenient to take time off, especially as providers. I mean, so much of our job has to do with helping other people, and people always need help, especially now. So it's never going to feel convenient. If you're waiting for your to-do list to be gone or the anxiety to be gone or for someone in your family not to need you, it's not going to happen. So you have to really be intentional and deliberate about self-care activities. Next slide, please. So here's another rare question. What works for you now? As a psychologist, especially during this time, people say, well, Dr. Ali, what should I do? And I always say, I don't know, right? Which sounds pretty silly coming from a psychologist because I'm supposed to be helping you. The reason I say that is because I believe that people are the experts on themselves. People know, people are resilient, and people just need to be reassured of that. People have tools to deal with uncertainty. If you are alive up until this point, in this moment, you have had a challenge that you've gotten through. I don't even have to know you to know that. I like to joke and say we're always in three phases. We're either going through a problem actively, we just got out of a problem, or we're headed in a problem. And this is sort of the cycle of life from the time we're born. There's always something. And so because of that, people know how to get through stuff. People know how to help themselves feel good. So a part of me presenting this slide to you is for you to think about what works. We tend to focus on what doesn't work. We just feel like we're drowning and we aren't doing something right. But there's a lot of things that you have done right and you do right. So what works for you now? So take inventory, and we'll talk about other strategies that may or may not be helpful. And again, some of these may be new, some of these things you may not have tried before and may be willing to try. And you may try them and they're not a good fit, they don't stick, and that's okay. This is trial and error, especially now that there's no blueprint on how to get through a pandemic, but definitely go to your tools. You have tools. Be reassured that you have tools. Next slide, please. So other things that you could be doing during the pandemic. So these are sort of pandemic specific. Monitor yourself, monitor your pace, have regular check-ins with colleagues, family members, and friends. They usually know when you're different or when things are off. Have working partnerships within your team. So it has been incredibly helpful for me to rely on my team when I have to take off unexpectedly. We have each other's back. So having those relationships and creating a team that you can fall back on within your organization has been life-saving for me, at least. Have supervision, have consultation, schedule time off, do relaxation strategies at work, take time out, focus on what's in your control. Appeal to your senses. So most people think that they, can do some yoga or something simple. Really try to engage all of your senses. Smell nice things, see nice things, feel nice things. Have a COVID plan. Everyone fears I am going to get COVID. If it hasn't crossed your mind, that is unlikely. I mean, we have all thought about it, and it's fine because it's our mind trying to protect us. If we can prepare, think about having COVID, then what we can likely come up with a game plan to make sure that we can persevere through it. Not a bad thing. We don't want to obsessively think about it, but have a plan and put it to the side. If I get COVID, where will I go? Who will take my caregiving responsibilities? What are my benefits at work to support me if I have to go on leave? Know these things. Don't hoard your PTO. Take time off if you need to. Don't always eat in front of your computer. And when you get home, even though boundaries are blurred, try not to do work at home. Try to just be in the moment. Next slide, please. So what are some problems with self-care? I'm sure up until this point, everyone's like, just take care of yourself, self-care. But honestly, do we really have time for self-care? Does self-care have to look good? Do you have to sort of do meditation with lavender burning in your office? No, you don't. Self-care can look however it needs to look for you. Enjoying your favorite chocolate bar, watching an episode of The Kardashians, whatever your thing is, it's okay. Next slide, please. And then I have to say, is this really, when you hear self-care, you see it all the time on listservs and, your colleagues are telling you to do it. It's just victim shaming. Do you feel like you aren't doing something right? Is it something you are doing where you're not strong enough to adapt? So I want to address that because burnout can feel like you're not resilient. I mean, what am I doing where I can't survive and can't sort of push through all of these stressors? Next slide. So I want to sort of shift. Self-care, yes, it's things that you can be doing at the individual level, but it's also to really lean on your environment, your work environment, to help with burnout prevention. This is systemic responsibility, not just an individual's responsibility. And so we need to normalize breaks. We are live in a culture where people do, go. We're all, we're driven by success. We're driven by helping people. We don't stop and slow down. And so we need to start normalizing this idea that we should be slowing down. Our environment should be supportive. And it really is transactional in that way, environment and the individual. Next slide, please. So what are some things that can happen at work? So again, because burnout can feel victim shaming, like you aren't doing something right, it's really important to start to radically shift how you think. If you feel guilt driven by not engaging in self-care and that the fact that you have allowed yourself to be burnt out, I want to reframe that for you so you can have, I guess, pay more attention to your fortitude and that you aren't broken. Sometimes just the system and the culture and the expectations and the society that we live in, that could be a bit broken sometimes. It's not supportive of self-care. Think about maternity leave or, PTO or all of these. I don't want to get too far into it, but we live in a culture that might not be as supportive of self-care and time off. But things that you can do in the workplace to battle burnout. Well, you can focus on how to improve the environment. That could be through flexible schedules to improve efficiency, teamwork, and leadership. That could be allowing documentation from home. For people who work with a certain type of caseload, consider diversifying your caseload. So if you're working with all spinal cord injury patients or all COVID patients, think about taking a break to work with a different type of patient profile, or maybe children. I'm not sure what all folks do, but diversify your caseload so you can have a break from the repeated traumas that are housed within a particular profile. Use your teamwork, right? Like I said, me and we have a buddy system here and my floor with a psychologist, and we have each other's backs. Think about workplace yoga. Think about taking time away from your desk. Here at our hospital, the psychologists were instrumental in sort of creating a resilience team for the hospital. So because we weren't meeting in team conference, we turned those rooms into break rooms. So it has aromatherapy and nice relaxing sounds. So people in the workplace can just go there for peace and quiet for a few seconds. Make sure your workplace has accessible information. I mean, COVID plans, COVID policies, support resources, all of these should be accessible and clear to people in the workplace so they know that they feel supported and have support available. Next slide, please. So here's another red question. What are your ideas? Again, my examples are specific to my work setting and what I do on a day-to-day basis as a rehab psychologist, but what might be useful in your workplace environment? Again, to make this interactive and to share ideas, because all of you have great ideas, please consider dropping them into the chat and reviewing them. Take notes if you've been taking notes on things that you may want to try or bring back to the workplace or share with management. Or if you're a manager, to try implementing or getting a needs assessment with your staff on what would be helpful with regard to modifying the environment to prevent employee burnout. Next slide, please. Okay, these are things to avoid. Most of you probably are already aware of this, but don't overuse alcohol or illicit drugs during this time. Abruptly making life changes can be detrimental if you are in the middle of burnout. Emotions tend to taint logic at times, so just make sure you are being strategic and logical and reasonable if you're making any big life changes right now. Avoid negatively assessing yourself or your work contributions, that you're not doing enough, comparing yourself to other employees or, your idea of what other employees are doing. That's not helpful, and it just makes you feel guilty. Avoid self-talk or other attitudinal obstacles. So, at work, I like to always joke and say, I tell my colleague, nothing's going to catch on fire, go home, take some time. Oh, but only I can do. No, you can't. We're a team. We can do this together. So sometimes realizing that, yes, you are important. You're an asset to the team. You're valuable. What you do is, you can't be replaced. But there are people in your work village who will help you. And there really can be, you can probably get reassurance against what you think is urgent and needs to be happen right in this moment, even at the expense of your sanity and energy level. You'll probably get reassurance that it's okay and it can wait. So try to avoid that type of talk. Again, I can't emphasize this as much. Helping others is important, but it's not more important than self-care. Back to the airplane analogy. If you do not take care of yourself, you cannot be your best self to help others. Avoid not wanting to talk about work experiences with others. This is not being a Debbie Downer. This is inviting opportunities to be uplifted. This is inviting opportunities to hear hopeful statements, to get encouragement, and avoid keeping too busy. If you always operate at a plate that's completely full, that doesn't make room for unexpected events, and then your plate cracks or flows over. So make sure that you're always operating a little bit under capacity to allow for room to for unexpected events. Next slide, please. And if you notice that things, these your burnout signs that you've mentioned or identified are prolonged, if they're functionally impairing, if they're interfering with sleep and relationships, if you can't shake it, if your sense of resilience wavers, then it might be time to get some professional help. So I always say, as a psychologist, I am not worried when people feel worried or scared or fearful or have a bad night's sleep. I mean, that is to be expected during a stressful time like this. Don't misattribute that to you having poor resilience, right? So it's not those things. Anxiety is going to be there. If I said, oh, your anxiety will be gone after you do a few self-care techniques, that's not true at all. Anxiety lives where it's uncertain. Anxiety will be there. It's about managing it. And when you feel like you can't shake it, when you're wallowing there too long and your sense of resilience wavers, that's time to get help. Next slide, please. So I like to start to end on a positive note. So again, all of you, if you're here on this webinar, you have fortitude and you are resilient. The fact that you haven't given up, that you're doing this webinar, that you're open to new ideas, that you're self-reflecting is an indicator that you are resilient. And so a part of being resilient is starting to understand that these negative emotions or these emotions that have a negative reputation, like anxiety and fear and irritability, those things are par for the course when in the middle of an unprecedented pandemic. Those things can exist simultaneously with resilience. These are not mutually exclusive. You can have a negative emotion and something positive at the same time. You can be scared to death for the future, but still grateful you're alive. You can feel fearful or angry at the fact that you've lost so much in the pandemic, but still be a great problem solver. I mean, these things can exist simultaneously. So just make sure you're opening up possibilities that allow you to see that you are a victor, that you are here and you can get through this. It's, resources are important, right? Resources for sure are important, but oftentimes what's more important is your ability to feel like you can make it through a challenge or sense of resilience. So just reminding you that if you're here, you are resilient. Next slide, please. This was a study that sort of spoke to that. So it's called Bloom or Boom. So the home lockdown, everyone's at home with their kids, or, some people are at home and it's exploiting loneliness. But this was particularly looking at families with children or preteens, 10 to 13. And so what they found is that there was a trajectory of resilience, that there were positive things that came out of this negative situation, that the daily hassles of having to do 100 things in one day were alleviated. There was more family bonding time. Parents had decreased overreactivity across time. So overreactivity suggests that parents are being more snappy or responding to kids with more anger or irritability, and that decreased over time. Values shift. Things just aren't a big deal anymore. You kind of aren't uptight as much as you used to be about certain things. So there can be some positive aspects to something negative, right? The silver lining. So I encourage you to think about what your silver lining is. Additionally, this goes back to my initial point that perceived stress can influence the direction of well-being. If you feel like you're struggling, if you feel that way, that might shift you toward endorsing more negative symptoms. If you feel like you can get through it, that might be protective. So your sense of resilience and your sense of stress that you're dealing with. Next slide, please. So here are some apps. One of the questions that I received was, what can I do during work? And so these are great apps. They I think Headspace for providers, if I believe at one point over the pandemic, we're giving providers or healthcare workers free prescriptions. So you might want to look into that. But these are all apps that let you take a pulse on how you're feeling, engage in a relaxation strategy, reflect, and this can be done in less than 30 seconds. If you have an Apple Watch, by no means I'm suggesting that people get an Apple Watch, but reminders or prompts to breathe are important. You can do that throughout the day. It doesn't take time. Stretch. If you have a standing desk, I mean, there are things that you can insert throughout your day. Happy to talk more about that. Next slide. I would be remiss if I didn't acknowledge Dr. Via Strong. She was a member on our subcommittee resilience team here. So she helped a lot of the department and the larger NRH family adapt to the pandemic. She was instrumental in creating some of the resilience rooms, and we made some of the handouts together. She gave ideas for these slides. So thank you so much, Dr. Strong. Next slide, please. And these are some references if you're interested in learning more about burnout and some of the research around that. There are some questions coming into the chat that are a little distorted, but I will read a few that I have. So one of the questions that I got was, Heather, did you want to jump in?
Sure. Thank you so much. That was fantastic. And we could just sit here for hours for sure. That's so relevant. Thank you. There's been quite a few questions, and you started to touch on it regarding the anxiety around contracting COVID, and you started to say develop a plan, but more specifically, probably about bringing it home to their families. Can you talk about that a little bit and maybe some ways to counteract that or how people should deal with it?
Sure. So I am also not exempt for that. I will share that I have a family, and that was one of my overwhelming fears when I when I had to come to work. I never stopped coming to work, actually, and I work in a healthcare setting, and this was prior to them, really understanding the protective behaviors. The anxiety is going to be there. It's always going to be in the back of your head because you love your family, of course. The only thing you can do is focus what's in your control, being mindful about practicing all of the recommendations, wearing a mask when you're at work, washing your hands, not introducing any risk. The anxiety will be there. If you're waiting for it to go away, I would say that's not a great thing. That brings us to caution fatigue. So it's just about managing it. If you notice that your anxiety is through the roof, is functionally impairing, then that requires more intervention. I would suggest going to a mental health provider or talking or looking at how you're thinking, but anxiety naturally is going to be there. So focus on what's in your control. Remind yourself that you are valuable at your job, that your job is important. And I think that's really all you can do.
Thank you. We also have quite a few questions regarding the burnout level in departments and teams, and regarding if you recognize that maybe a colleague has burnout and they don't recognize it, but then also how do you start to deal with it or approach management if the whole team is burnt out?
Yeah, so I do think that the responsibility relies on both management and the team members. Again, it's a shared responsibility addressing burnout. It's not necessarily all on the employee. One, I would encourage management to check in, right? The white elephant, like just address it. Ask your staff how they're doing, monitor for efficiency, take pulse of, productivity, and address it in a way that's sensitive, address it in a way that's compassionate, and address it in a way that's normalizing behavior. So, or normalizing stress during this difficult time. So I think management has the obligation, but for employees who are recognizing that colleagues are burnt out as well, I think the same approach is important. asking them, how are you doing? How can I be helpful? I would say open-ended questions are probably best because you invite them to introduce how they're feeling, you allow them to be heard, and they're the experts on them. They can help with suggestions. You don't have to superimpose, what you can do on your colleagues. But for sure, I think creating a culture of normalization is so important. Asking people, how are you doing? How can I be helpful? So we have to talk about it. Do not talk about it. I guess that's my biggest piece of advice.
Thank you. I think we just have time for one more question. So I think the other thing that you started to touch on is the grief that people feel. So when, we're caregivers, so, for the patients who don't make it and then being afraid with the second outbreak, how can you keep your mind out of that fear?
Sure. That's a very, very, very real fear. I think a lot of people have been traumatized, especially frontline workers, during this difficult time. A lot of that is anticipatory anxiety, right? And again, it's meant to serve you because if you can prepare for something horrible happening to the people that you serve, it almost helps you want to figure out a plan to protect yourself. But anticipating that it's going to be another surge, anticipating that you're not going to respond well, anticipating that everyone around you is going to pass away. Anxiety makes us think catastrophically. I don't know if that's going to happen. You don't know if that's going to happen. So focusing in on the here and now. Yes, that could happen. I don't know. You don't know. But what about in this moment? What can I do to help myself feel meaningful? What can I do to manage my anxiety? So focusing in on the here and now. But anxiety for sure is going to be there. It's just about recalibrating your thoughts to be less catastrophic because the truth of the matter, we don't really know. We can anticipate, but we don't want to have too strong of an emotional reaction to anticipation.
Thank you. And thank you, Dr. Lee, so much for your great insights and tips. And we really value and appreciate your time to help us with something that's so critical to all of our health and well-being. Good. So thank you all for watching today's webinar. We hope you found the information informative and useful. For COVID-19 resources designed specifically for healthcare workers, please visit the APA's website at the address shown on the screen. We will also put the web link in the chat so you can access it easily. We invite you to join us at the next mental health webinar, which will be in December, and we're going to cover the topic of resilience. More information will be available on all of our websites soon. And finally, to claim your CME credit, please use the link shown on the screen. Staff will also put the CME information link in the chat. And with that, thank you so much for your participation. Be safe and well. Take care, everyone.
Thank you for participating in this mental health series brought to you by Intellios and its family of certification councils in partnership with the American Psychological Association. You will find additional resources at ardms.org, apca.org, pocus.org, and apa.org. These resources are for informational purposes only and should not be used as a substitute for professional medical advice. We encourage you to reach out to your personal physician or medical provider if you have concerns or questions.